Hi, welcome back to Rebel Movement Podcast. My name is Billy. My pronouns are they, them, or she, her. I'm really excited for a lot of the episodes we're doing recently. Today, we're kind of expanding on our, I would say, kind of taboo topics. I don't think they should be taboo, but I think that unfortunately they kind of are. I'm talking with my wonderful friend, Sandra, about sexual health and fertility, and just in as just as the same as in the last episode we did menstrual health. This episode is also very gender neutral language. I don't think there's a single even medical like jargon thing. Maybe I mean jargon in terms of like female male mentioning. I could be wrong because I recorded this like last week, but I'm stoked about this episode. Just like the one with Ashley, I feel like this is going to be, I mean, we already know this is going to be one of a couple of episodes. I'm stoked about it, honestly. So I'll just let you enjoy the interview, and I'm so excited to hear what you think. Thank you so much for joining. I'm really excited for this conversation. Do you mind telling us a little bit about you and as well as your pronouns and your name?
Yes. We'll start with the name. My name's Sandra. My pronouns are she, her, and Billy invited me on this podcast to more discuss kind of like areas of work that I've worked in. I'm a registered nurse and kind of worked all over the place in Canada, but as a travel nurse and in the hospital and things like that. But lately, in the last few years, I've kind of honed my focus into what I'm really passionate about, which is sexual health and reproductive health. I moved to Vancouver a few years ago and worked at a fertility clinic for 3 years. And then now I'm up in the Yukon territory working at an STI clinic and I'm loving it. So
Yeah, that's
that's my
awesome.
Coles notes.
Yeah, thank you. I appreciate that. Was there anything that, like, any moment or incident or I don't know, thing that happened that made you really decide to go into fertility and sexual health?
Honestly, it's really interesting in not really, I guess not really that interesting, but I think everyone in nursing school thinks, oh, I'm going to be emerge, I'm going to be ICU. And for me, it was like, I was going to be pediatrics. I was like, want to work with kids. I want to work in the NICU. Like, and I tried those areas out and I did really like them. Like I didn't hate them by any means, but I wasn't super passionate about it. Like I thought I was going to be. And then in Kingston, I got a job casually on the sexual assault and domestic violence team. And it kind of opened my eyes into like the areas of reproductive health and sexual health that are underserved and trauma informed care. I became really passionate about kind of implementing that into my daily practice. And I realized I wanted to work more with that kind of population, I guess, of just like talking about sexual health and destigmatizing things and talking openly and making people feel comfortable discussing that. And that was kind of a big way to to get introduced to that area. But I really, really fell in love with it. And then when we moved to a bigger city, I thought, okay, well, what other areas are not related? Like fertility is not at all related to sexual assault nursing by any means, but in a way that you're talking about things that are very intimate, very personal, and making people feel comfortable in a moment that they might not be.
Yeah.
So, yeah, yeah.
I can imagine that the trauma informed care would come in handy in that kind of working environment, eh?
Definitely, it really did. Yeah, yeah. I would regularly like host learning sessions about trauma informed care and things like that, just for like informally for my coworkers, just because it I learned so much about it in my previous work, and it's so applicable to every area of work, not just nursing, but
Yeah.
every area anywhere.
Yeah. I
So
totally
yeah.
agree with that. Yeah. Is
Mhm.
there one, I guess this is not necessarily specifically on the topic, but is there one I know it's a really big topic as someone who's also done some trauma informed learning. Is there like one piece of advice that you would as like your go-to to give folks?
Oh man, so many. What's my one piece? I'm big on like breaking down, kind of making sure everyone knows who I'm talking to. Everything I'm laying out as an option, and they get to pick and choose. I sometimes call it like it's a choose your own adventure, particularly with like, I'm thinking of my current role as an STI nurse. I sit them down, we talk about, how the appointment's going to go. And then I say, like, I'm going to lay out a bunch of options for you. You get to pick and choose what options. I'll help you like weigh pros and cons if you need to. Those are the kind of, and just letting people know that they can kind of opt in, opt out whenever they want. And like putting that kind of out there before you even start an interaction with someone, I think makes people feel really comfortable right off the bat, and allows them to have a little bit more autonomy in a relationship where you definitely hold the power. So
yeah, that totally makes sense. I really like, it feels really nice to hear that there's someone that works in this kind of setting that has that type of approach, because I know that it can feel, there's like a lot of emotions that can come up when you're having to deal with that kind of thing, and not all clinics or doctors' offices or whatever environment are very welcoming.
totally. Yeah. And I think any person who's accessed healthcare has probably had maybe a lot of positive experiences, but also maybe some negative experiences with healthcare providers. And it doesn't foster a trusting relationship, which means that you're also not being able to provide the best care when your patient doesn't trust you. So
Yeah.
yeah,
That makes sense.
hmm
So I know there's a lot we could talk about in this topic, because it's like multiple topics in one, at least as an
yeah.
outsider's perspective. I do not work in healthcare. I'm not an expert in this
All
area.
good.
um, is there anything particular that you're like stoked to start talking about in terms of like in this podcast? Or if not, I can ask you a
um
question, but I just wanted to throw it out there just in case you're like, oh, I got to make sure we talk about this, or this is one thing I wish more people knew.
No, maybe I'll throw in a little pitch for an HPV vaccine. I've been
Yeah,
really
go for it.
passionate about HPV vaccines lately.
Yeah.
Um, I need to cite my sources, but I'm just gonna word them out. Basically, the HPV vaccine is otherwise known as Gardasil, helps prevent against several strains of HPV that can cause cancers, and not just cervical cancers. It's good for men to get too, especially like queer men or queer people with penises who because it can prevent against throat cancers, anorectal cancers. Like it's a really great vaccine and it's proven to be very effective. And there were recent studies in Europe somewhere. I'm sorry that I don't have the exact source, but
That's
recent
okay.
studies that were done that they um, studied a bunch of people that received it in childhood and went on to, and basically we're trying to measure how many people did develop cervical cancer
Hmm.
later on. And they thought that their results there was an error because the result was zero. And they're like,
Wow.
this can't be right. And so they repeated the study and it was right. Like it's that effective at preventing at least cervical cancer. We don't
Hmm.
have the studies to back up the other stuff, but I would, hazard a guess that likely it's good at that too. So,
Yeah.
anyways, basically, get your HPV vaccine if you still can, if it's like free. Certain provinces and territories have different regulations on who it's offered free to,
Oh,
but
true.
ask your healthcare provider if you can get it for
Hmm.
free, or if there's any way that they can write a letter to get you that vaccine because it's just so effective. And I've just been thinking about it a lot lately about how we need to advocate for it more. Yeah.
Yeah.
Here in the Yukon, everyone under the age of 26 qualifies for it for free, which I think is
Oh,
very,
cool.
like, it's good, but it's not as good as it could be. I
Yeah.
think it's one of the best policies of any of the provinces or territories, but still, I'm like every 20-year-old, I'm like, oh, get your
Mm.
HPV.
Yeah, I get it
So,
while it's
anyways,
free.
that's my pitch for the beginning of the podcast, but we can talk about
I
other
like
stuff.
it. No, that's okay.
Yeah.
I have had my HPV vaccine. I had, well, I don't know if it's still like this because this was quite a while ago, but there was three, like you had to get three of them. Is it still like that now too?
Yeah, it's just a series of three. Yeah.
Hmm.
One is better than that and none though, is what I tell people. I'm like,
Yeah.
if you want it and you want to pay for it, like you can pay for one and better
Hmm.
than, zero.
Yeah.
But
Yeah.
yeah, yeah,
That's true.
yeah,
Yeah.
that's great.
Cool.
But
I'm trying not to go into
yeah.
my story about why I had to get it for some reason, but um, yeah, I really appreciate that at the beginning, because I do think that I don't think this stuff is talked about as much as it should be. And
Yeah.
just, um, I did an episode, I just was telling you this, but just in case anyone listening doesn't know this, I did an episode well, for me, it was a couple days ago, but if you're listening, it was probably longer than that. About like menstrual cycle and menstrual health a little bit. And I am not
Mhm.
someone that I would say that has like not learned anything. Like my mom was growing up as a nurse and she had diagrams um and I still there was things that I was like, "Oh,
Yeah,
I didn't
yeah.
know that." I didn't like
No,
it feels
there's so many
really
wild things that you learn. I'm talking like just starting at the fertility clinic and learning like more about the menstrual cycle from a fertility point of view. I
Mhm.
was like, my mind was blown. Like I had no idea how any of this stuff worked. And that was only a few years ago. And I'm
Oh
like,
yeah.
I didn't learn this in nursing school. I didn't learn this in any sort of like capacity that I've ever had. So you are not alone.
No, I'm glad for that.
Yeah.
Was there anything in either in menstrual health or sexual health or fertility, was there anything or maybe a couple of things that like really stood out to you as I guess as blowing your mind? I don't know why I said that in such a complicated way.
Yeah. Yeah. In the fertility clinic, we mostly were working with couples or single people who wanted to become parents, who were undergoing IVF or in vitro fertilization, or IUI, which is intrauterine insemination. So the difference between those two basically is that in IUI, we're timing out when a person ovulates and we're putting sperm in there at the right time and
Mm,
hoping that it meets the egg. So it's a little bit, a lot less invasive,
mhm.
I should say. But the chances of success are lower just because it's not done in this. We're trying to hope that they meet each other rather than making sure they do.
Right.
IVF, on the other hand, a person is undergoing an egg retrieval. They're in the lab, the sperm and egg meet, and then they do an embryo, like they
Mm,
grow into an embryo, and then they transfer it back in.
mhm.
So in terms of like what really blew my mind was I got a lot of questions about like, well, if I'm getting an egg retrieval, like, are all my eggs going to be gone? Like, are you taking all of them? Like, will I still have
Mhm.
them? And what was really interesting is that like we actually, uh, people who have eggs have like a cohort of eggs every month, for their cycle. And that cohort of eggs kind of like grows together in the follicular phase, beginning phase of your menstrual cycle before you ovulate. One egg is chosen as a dominant follicle. They all live
Mhm.
in these follicles, which are little egg houses, basically. So one follicle is chosen dominant, and the rest of them just kind of like shrivel away, and they're like
Mm,
gone. They just get wasted by the body.
mhm.
So what was interesting about IVF is that we would harvest is such a gross word to use. I'm sorry, but take the eggs from that cohort only. So you can't. It's not possible to retrieve all your eggs, if that makes sense. It's
Mhm.
it's only the ones that your body would have had made available for that month alone, and
Right.
then the next month you got a whole new cohort of
Mhm.
follicles,
Mm,
eggs in their follicles. So thought that was kind of interesting. And each person has like a different size of cohort, depends on your age, it depends on so many different factors, genetic factors, et cetera.
mhm.
And I was just learning so much about that in itself. I was like, I didn't know I had a cohort of eggs
No,
every month
neither did
that
I.
that like grows, and then I have a dominant one, and that's the one that gets to ovulate. Maybe two
Mhm.
if you're one of those ones who get could result in twins, kind of thing. But
Mhm.
yeah, basically that's what one of
Wow.
the I found that process really interesting and fun to explain to patients. I really like educating people about their bodies too. So I thought
Yeah.
that was really interesting. Yeah.
Yeah. That is really interesting. I
Mm.
didn't know that either. I didn't know that you had
Yeah.
cohorts. Is it and this feels like a ridiculous question now that I'm trying to say it out loud because it seems like it would be invasive, but is it a really invasive or like painful or difficult procedure to have the eggs taken
Yeah.
or harvested or however the technical term
Yeah.
is?
I was a nurse there, but I was also a patient there. So I also did do an egg retrieval when I worked there, which was interesting and cool to be on like that side of the team, if that makes
Mhm.
sense.
For sure.
And so I got to experience it firsthand. And yeah, I knew it was going to not be comfortable. Like the lead up to the egg retrieval, you're doing injections every day to grow, not only grow your follicles, but also stop you from ovulating, because when your follicles get to a certain size, your body's like gonna want them to ovulate. That's
Mhm.
natural. But you want them to grow, but keep them inside until we can get
Right.
them right. Um, so you're doing injections. And that part, like, I don't love needles, so that part wasn't fun, but it's not horrible.
Mhm.
They're not like intramuscular injections. They're in your subcutaneous tissue in your lower belly, so it's not terrible. But then the procedure itself, you have to get it's like a guided ultrasound, so it's intravaginal.
Mhm.
Um, and then they use a needle with attached to basically a vacuum that
Oh,
pokes into each
whoa.
follicle and
Yeah.
sucks the follicle out. If that
Huh.
makes it, not the
Yeah.
follicle out, but the
Yeah.
liquid that's within the follicle. So it's kind of
Oh.
like bubbles that you're sucking out the liquid inside the bubbles, if that makes
Whoa.
sense.
Yeah, that makes sense.
Um,
Cool.
yeah, so obviously you need a lot of pain meds. They gave me fentanyl, which is
Mhm.
very safe to use in a healthcare environment, with the proper dosing and all of that stuff. Uh, but yeah, and I was fine. It was okay. I didn't find
Mhm.
it super painful. My partner did find it very painful, but she had a lot more follicles than I did, so her procedure was a
Oh,
lot longer.
that
So
makes
she had to
sense.
kind of undergo it for a lot longer than I did, for
Yeah,
sure. Yeah.
that makes sense. So
Poor
it's just
thing.
like very different. Yeah, poor thing. It's just different
Yeah.
person to person then.
Yeah, totally. She had almost like a concerning number of follicles. So,
Oh, interesting.
a high number, a super high number can maybe indicate PCOS. So we weren't sure if like some of those
Oh.
follicles wouldn't have like high quality eggs.
Mhm.
But we ended up both getting really great numbers overall, so we're pretty happy with our results.
Well,
But
that's good.
yeah, it ended up okay. But yeah, unfortunately, because she had so many follicles, her procedure was just like a lot more.
Oof.
And her even leading up, like it felt like she's like, I feel like she's never been pregnant,
Oh,
but she's like, I feel like I'm pregnant. I feel so
yeah.
I'm having trouble like walking and moving around just because like her ovaries, your ovaries are normally the size of like almonds.
Mhm.
And by the time she was ready for her egg retrieval, her ovaries was the size of oranges.
Oh
so
my
so both of them
gosh.
were just like
Oof,
very
no
she
wonder.
felt very full.
Yeah.
But yeah,
Yeah, it makes sense that she would. That sounds I can yeah. That's one thing that sorry, that made me think of something else. That's sorry. I'm gonna just gonna say that sounds really painful and I can
yeah.
understand why it would be oh poor thing. Um I didn't know until recently. This is related but not exactly like and it's similar anyway.
hmm
I saw a picture, which this could be, I'm not saying this is facts because I'm again not the healthcare worker, but
That's good.
of is it your oh see now I can't remember any of the terminology of your is it your uterus before and during like before your period and during your period and the
Yeah,
size
yeah.
difference isn't it like I don't know if it doubles or if there's like a big difference
I
or
mean, I'm not sure about that actually. I don't know the like size difference, but I'm sure it gets bigger with the lining increases throughout your menstrual cycle
hmm
and then sheds and probably kind of because it kind of collapse. People think of it like it's like an open cavern, like an open space
yeah
in your body. But it's really kind of like a collapsed on itself, you
oh
know? And
yeah
then until something's in it that it needs to
right
hold on to.
oh that's
So
cool
yeah, probably if it has a thick lining, then it would be less collapsed on itself. So it would
yeah
be
oh
bigger,
that makes
is
sense.
what I'm thinking, but I don't know the exact,
Oh, that's totally fair.
size
I'm just like
difference. But
throwing random questions out at
but
you.
it's so interesting. Like it's like I don't know, reproductive health is so cool and so interesting. And
Mhm.
not to I didn't mean to like fear monger anyone about fertility treatment, but we had a really great experience and we
Did
weren't
you?
like, it wasn't super horrible. It wasn't like super painful or anything like that.
Mhm.
We both had our like pain meds were very well controlled. I got some Ativan too. We both did beforehand,
Yeah.
and I felt great.
Did you?
Um, yeah, I love Ativan. I've never taken it before. I haven't taken it since, but I was
Yeah.
feeling pretty good.
Pretty good?
um, yeah.
So the
So
pain
I mean,
wasn't too bad?
it wasn't unbearable. I think I hyped it up more in my head than I needed to, just because I've just seen so many people go through it
Oh, yeah.
leading up to my time. So I'd seen people tolerate it super, super well, and then seen people have a really hard time. So I was like,
Mhm.
oh God, what's it going to be like for
Yeah.
me? But it was okay for me.
Yeah, that's
But
good.
yeah, but I
I
do
can
that
ima
even with like a flu shot. I'm just like,
Oh,
ah,
same.
and then I
Same.
get it. I'm like, I mean, I love the vaccine. Don't get me wrong, but needles are still scary.
Yeah, yeah. I
Yeah.
definitely get nervous for anything like that, or I build up in my head that it's going to be this horrible thing, or you just don't know how it's going to go, and it could go badly, but
Totally.
it probably won't go badly. And then it
Yeah.
happens and you're like, oh, good thing I didn't panic. Like,
Yeah.
like,
Yeah,
yeah.
good thing I didn't, really ruminate on this for a really long
Yeah.
time leading up to
Like not sleep
it.
for weeks.
Yeah.
Oh man. I can imagine it would
Yeah.
be a really emotional. I mean, I guess not for everybody because everyone's different, but I can imagine at times for some folks it'd be a really emotional process
Oh,
too.
yeah. I, like, sobbed on the table during my egg
Yeah.
retrieval. I think it was also fentanyl induced. Fentanyl can make you quite emotional.
Mm,
It's a very, like, short half-life, meaning it, like, works really quickly and then leaves your body really quickly.
hmm.
Um, but so it just, like, that feeling can really, like, bring out all the
Oh yeah.
emotions. Plus, you're, like, dosing yourself up with hormones, like, for 2 weeks beforehand.
Oh
So
yeah.
yeah, so it can be emotional in many ways, and I am also not someone who, like, I was doing it for, after having tried to have
Mm,
a pregnancy, right? Like, I think
hmm.
it can be emotional in a very different way, and probably a lot more emotions for someone who has been trying to get pregnant for many years and then not successful, and, like,
Yeah.
leading up to, like, this big moment where they're kind of just, like, putting all their trust into to a team of people, and that can be really scary and I'm sure really emotional, and yeah, I wasn't doing it for that reason, we were doing it for fertility preservation reasons, knowing that we will need fertility treatment later to have, like, children, so,
Oh cool.
it will get emotional then, I'm sure,
Oh
when
for
we're
sure.
actually trying to get pregnant, but for
Yeah.
now, it's just, yeah, I feel like for my patients, I could really see kind of why they would feel the crazy, huge amounts of emotions that they're feeling. Yeah.
Hmm. Yeah,
Yeah.
that makes a lot of sense. Yeah,
hmm
I can imagine.
Yeah.
What is oh, I just forgot the term you just used. Fertility preservation.
Right. Yeah. Like egg freezing. So
Mm,
a lot of, so IVF really specifically is freezing embryos. Like, so an egg and sperm joined and grown into an embryo and then freezing that. Whereas egg freezing, what I did with my partner, we both froze eggs, just our eggs. We don't have sperm yet. So that's just frozen the way that they are. And that's usually done for like fertility preservation reasons, quote unquote, meaning like, I'm not sure if I want to have kids, but maybe I'll want them later. And like, I'm getting older and I just want to like put that in a box and like that can be my little like insurance policy kind
mm,
of thing.
hmm.
There's no guarantee ever. Like it doesn't mean that, it'll definitely work later, but at least, I'm in my 30s. I froze my eggs when I was 30. My partner froze hers at 28. So it'll be nice to know that like, okay, even if we wait like a little bit longer, like I don't have to stress out about my biological clock or whatever people
Yeah.
are saying now. There's a lot of pressure on the people who can bear children to do it soon and maybe do it before they're ready. And so I love that it's an option for us. I hate that it is not a financially affordable option.
Yeah.
Yeah, it's one day, hopefully, we'll have some more like incentives or like tax breaks and like reimbursement programs and things like that. But like for now, it's very unaffordable and unattainable
Hmm.
for most people. I was lucky as an employee, I got a
Oh,
discount,
that's
which is
good.
nice.
Yeah.
But
Yeah.
yeah, it's not easy to afford for sure.
Hmm.
Yeah, yeah,
Yeah. That's definitely something I feel like is seen a lot and talked about a lot is that like your biological clock is ticking. And
hmm
there's I've definitely felt that pressure where you're like, do I not want? Like what if
yeah. And
I
then you're like, how do you make that decision? Like
mhm,
that's also a life changing decision. I'm not even sure if I want kids, and I froze
mhm.
my. I'm just like,
Yeah.
I'm like, do and after I froze them, I was like, do I even want this? Like, I don't know. Like, that's a huge decision, right? And
Mhm.
it's yeah, and it's stressful to have to make it under pressure. I think
Oh yeah,
a
for
lot of people
sure.
feel that way.
And then
Yeah.
I've heard from some folks with uteruses who've tried to go to the doctor and who know for sure they don't want kids. They've tried to go to the
Mm-hmm.
doctor and ask for like their tubes to be tied or I don't know if there's other
Oh,
procedures and the doctor's
yeah.
response is like, "Oh, you might change your mind."
Don't get me started. Oh my gosh. That makes me so upset.
Yeah.
Like, geez. Yeah, or like, have you talked to your partner, like your husband about this? Or your
Yeah.
partner about this? You're just like, excuse me? Like, why did they get a say in what I do with my body? This
Yeah.
is
Yeah.
wild. Yeah. Yeah.
Yeah. It is
And
wild.
like people who get vasectomies don't get questioned, like people who have vaginas. So
Mhm.
doesn't make a lot of sense to me.
No, me
But
either.
yeah,
Yeah, and
yeah.
I knew one person who they had other, health issues, which meant I don't know all the details, but which meant that getting this procedure would be like, save them a lot of pain and suffering or whatever,
Mhm.
and even still, they were facing this barrier, and their partner had to, like, come into the doctor and, like, sign something or just
What?
explicitly say, like, "I know about this, I'm fine with this." Like,
That's
they
so
had
wild.
their treatment, and yeah, it's wild to me that that's I don't know, we
Yeah.
don't
It should not be okay. Or
no.
they I don't know why that is treated like it's something that's normal when it's really not. There's a lot of, like, patriarchal, norms in healthcare that, like, persist to this day,
Mhm.
and I find it really insane. Like, not quite to the infuriating level of that, but something that would always bug me so much was at the fertility clinic I worked at, there was certain tests you had to get done before you got your appointment with the doctor. Basically, you need some certain blood work tests done. Everyone needed STI testing because it's just for, like, you know, the fertility clinic needs to make sure you're healthy, and like if
Mhm.
there's any issues we need to sort out before we get you started. Like nothing's a barrier. It's just more like let's see what we're working with kind of thing.
Right.
And for people who would be doing like an egg retrieval, they needed to get like a blood work test called an AMH, which is an anti-Müllerian hormone test. And it's kind of an estimate of the number of follicles you'd have each month, that cohort. It's a blood work estimate of that number. And in BC, where I worked, it cost $70 at the time. I think it's a little bit more now, but it cost $70 to pay for it, which for someone who's doing fertility treatment, it's like a drop in a bucket. Like, sure, it's not a lot of money, like, whatever. But then for someone who's, giving the sperm to this procedure, they get to go and do a free semen analysis. And I'm
What?
like, how come a blood test that's like just running it through a machine likely costs $70 and a semen analysis where you have to look at sperm under a microwave and take like 7 or 8 measurements of the sperm, that's free. That's paid
Mhm.
for with your health card. So I'm like, not that it shouldn't be. I'm not saying that, but I'm saying how
Mhm.
come this like very basic fertility indicator is free for one half of the population, and then
Mhm.
this other one, like I'm just like, oh my god, it would drive me crazy. I was like, I'm so sorry that this is
Yeah.
something you have to pay for out of pocket when really it's a basic fertility indicator that should be offered to everyone for free.
Yeah.
But yeah, kind of
Ugh,
wild.
it
I
is
didn't
wild.
love that discrepancy.
No, I
Yeah,
wouldn't have either. Yeah,
yeah,
that would bother me as well.
yeah, yeah,
Ugh,
for
yeah.
sure. So,
There's so much I feel like there's so much of that part of the I don't know, that perspective of perspective doesn't feel like the right word. That side, I guess, of sexual health and fertility that is I feel like I don't know, it's just so frustrating to see. I don't
mhm,
even know. I've had experiences before where um like when I had to go to the get my HPV vaccine, for example, I had to get it because I had HPV.
mhm.
And the circumstances were not a positive one, we'll just say. And the doctor from the very first time I went in was so judgy and was like,
Like,
I made
what?
this horrible mistake. Like, you don't know my circumstances
Yeah.
at
You
all. So,
also every like I think it I forget the stats. I'm so sorry, but it's like at least like 7 out of 8 people who has sex is going to contract HPV.
wow, that's a
HPV
high
is
number.
so
Yeah.
common. There's like
Hmm.
40 different strains that like 200 strains that affect your body.
Hmm.
40 different strains that can affect your genitals. Most of those strains are completely harmless. They just get cleared on their own
Hmm.
from your body. But like
Hmm.
some of them aren't, and those can cause issues. And that's why we have pap tests, and that's why we're
Yeah.
introducing HPV screening, hopefully soon to everywhere in Canada. BC is introducing it.
Cool.
But yeah, it's not something to shame anyone for. And it's also like pretty invisible. So it's not like you can ever really prevent like contracting that. You know what I mean? Like it's
Yeah.
very normal. It
Yeah.
would be weird to not have encountered it at some point if you're having sex. Do you know what I
Yeah,
mean?
for sure.
So yeah, I'm sorry that you had that experience. It's
Oh,
really
thanks.
frustrating. Yeah.
Yeah. I
Yeah.
think it's also, um, it just feels, I think good, a good, like a, it's going to sound ridiculous out loud again too. Feels positive, like a good thing to talk about this kind of thing in the podcast and in general, because when that happened to me, it wasn't really talked about very much.
Hmm.
Um, so when I had the situation happen, um, the person had said, "Oh, it's not um contagious," and did their mind trick bullshit, and I didn't know any better. And then when I had to go through all this stuff, like different treatments and the vaccine and stuff,
Hmm.
I felt like alone in it, and it was this like big scary thing that I felt I like carried shame from that for years. Um,
Yeah.
but just hearing it that it's so common is like, oh,
So common. Yeah.
okay, like,
Yeah. Yeah, because no one talked about it then, so it makes sense that you thought you were alone in it, but it's just
mhm,
such a common thing, and I feel like I have to, like, yeah, talk people down a lot in my clinic of just, like, because what's, moving from herpes, HPV to herpes, which is HSV, which I think people also get confused a lot of the time, but they are different.
yeah,
They're very different. So many people are scared of herpes in my clinic, and like not to laugh at it because it's not a funny thing to laugh about because people don't genuinely don't know, but like herpes is not harmful. Like it's
no,
annoying. Don't get me wrong. Like it sucks. It sucks because you get open sores that are painful. They go
mhm,
away. Sometimes they come back, sometimes they don't. Generally, generally, like they're okay. Everyone's fine. It's not going to
mhm,
hurt your health at all long term. It's just annoying. Like
mhm,
cold sores are just a nice way to say herpes. Everyone's got cold sores. So, and my like favorite stat I tell people is that if we tested everyone's blood in Canada, 90% of people have antibodies to a strain of herpes
wow,
because it's just that common. Like some people are lucky and they don't get lesions, and some people are unlucky and they get lesions. And
mhm,
we don't test for it routinely because we have to hire a whole team of people to call everyone back and then talk them down and be like, "You're okay. Like,
right,
you don't get lesions. You're okay. You just probably encountered like maybe you kissed someone who had a cold sore once or gets cold sores and you're okay.
mhm,
Everything's cool." So I feel like there's a lot of like this destigmatizing that has to happen because in school we're taught that you're gonna have sex, you'll get pregnant, you'll get an STI, your genitals will fall off, and you'll die.
mhm,
Like
yeah,
that's what we're taught
that's
this like
totally it.
horrible stuff, right? And like 99% of STIs are completely curable. 100% of STIs are manageable with
Mhm,
medication. Like
mhm,
100%. Even the ones that aren't curable are manageable and you will not kill you. And you'll live a full, long, happy life with no health issues with
mhm,
medication. That includes HIV,
wow,
especially.
yeah,
So yeah, it's one of those things that we're just not taught. I think in our generation, I hope in generations. It depends where you grew up, but I hope it's getting better. But I don't think it is in a lot of places.
yeah,
But yeah, just the sex ed needs to be less fear mongering because people are gonna have sex and
mhm,
then they don't know what to do when these things happen. You know
yeah,
what I mean? Like find out they've gotten into contact with chlamydia and they panic. And it's like, guess
mhm,
what? I'm gonna give you 4 pills and you're gonna be okay. And like
mhm,
that's that's it. Like very easy to treat. So
yeah,
anyways, the stigmatizing of STIs and the shame that healthcare providers like put on their patients is completely unnecessary and like doesn't encourage people to come back and seek out care
no,
later.
yeah, that's
Mhm.
true.
Yeah.
Just in case anyone grew up in a place or grew up in an environment or place where they don't know what to do, if they suspect they have an STI or something, what would you suggest they do?
Um, seek out uh, if you can, if there is an area near you, but seek out a specifically sexual health clinic, like an
Mhm,
STI clinic, a sexual health clinic. If they specialize in that, they're going to be able to. They see what they see every day. They're going to be able to answer all your questions, hopefully not in a shameful or judgy way because they deal with it every day and they're not an uneducated healthcare provider, hopefully.
Yeah.
So if that is available to you, then I recommend seeking out um, care at a specifically sexual health clinic.
Mm-hmm.
If not, if you have any issues, like any concerns about anything going on down there, I
Mm-hmm.
always recommend seeking out healthcare in the most accessible way that you can, just to make sure things are going okay, checking things out. It's better to like be safe and get the treatment and do what you need to do or get the testing that you need, just to put your mind at ease too, so you're not stressing about it.
Mm-hmm.
And there is a couple STIs where you get symptoms and then they go away and you think everything's okay, but it's still there lingering. I'm thinking specifically of syphilis. Syphilis is so tricky, but you can get symptoms and you're like, oh, that's weird. And then they go away. And then you're like, oh, I guess I'm good now. But it stays in your system until you get your treatment.
Mm-hmm.
So it is important to get things checked out when they do arise.
Yeah.
What my main
Yeah.
recommendation. Yeah.
That's helpful. Thank you.
And don't spiral on Google is my
Yeah.
other recommendation.
That's a good recommendation. That's a very
Yeah,
good
yeah.
recommendation.
Yeah, there's a very good website called Smart Sex Resource, and if you need to spiral on the internet, that is the website to spiral on.
Smart
Otherwise,
sex resource.
Smart Sex Resource. It's
I'll put
run out of
that
yeah, it's
I'll put
in
the
the
link in the
notes.
show notes. Yeah.
Cool.
Yeah.
It's run out of the BC CDC, so the BC Center of Disease Control, and it's all up to date. It's not scary information. It's all like good, clear, important information that's not gonna like freak you out. And then it'll
Mm-hmm.
tell you if you need to go and get checked out. So
Mm-hmm.
yeah,
That's
it's
really
a great
helpful.
website.
Yeah, I'll definitely put that
Mhm.
in the show notes. If anyone listening, you could just like, I don't know, save it or have it
Yeah,
as a bookmark. So if you feel like the need to spiral, go there.
totally.
That's
Yeah.
very
Don't
helpful.
just type herpes into Google and press images. Like that's just
No.
like not gonna result in that, calm calm setting. You
Mm-hmm.
want like that's just not gonna help you at all because it's just Google and it tries to pull up whatever it can, but it's not gonna
Yeah.
be accurate or right. Yeah. So
Yeah. And maybe listen to this
yeah.
episode again because I'm not in the situation where I would need to Google, but I feel like calmer about. I'm not. Yeah, I wasn't even in a spiral, but I feel calmer about everything
Yeah,
after this
good. I'm
conversation.
glad.
Hmm.
It was kind of hopefully I touched on lots of stuff, but but yeah, we kind of circled all over the place, but hopefully it was helpful
Yeah,
to someone.
I think so. Is there anything that you want to add or that you wish more people knew or anything like that that's coming up?
Oh man, so many things, but to think pinpoint one thing, I don't know. I touched on HPV vaccines. Get it if you can, and yeah, talk to your partners. I think that's going to be the takeaway. I
Hmm.
feel like I see a lot of people that are like, "Oh yeah, I'm coming in and getting tested. I don't know if my partner's been tested." I'm like, "That's it. It's
Mm.
a cute date to go together to get
Yeah.
tested. Like that's cute and hot. You can have more fun if you bring your partner, your partners to the clinic. I'll get tested. That relieves some worry off of you, and then you can have a better time hopefully because you're not stressing about anything.
Hmm. Hmm.
Yeah, yeah,
That's helpful. Yeah.
yeah, totally.
I feel like I have so many questions for you, but I don't want to take up too much of your time. But
Totally fine. I can talk about sexual health, reproductive health all day, every day. So
yeah.
this has been fun.
Okay, sweet. Yeah, I think so.
Great.
Yeah, it's been very fun. Thank you so much. I've learned a lot from this. Um, and I'm just trying to think if there's anything that I should ask before the end. There's like 5 million questions just spiraling in my head, spiraling, whirling in my head.
Yeah.
Um, I don't know. I feel like I can't. There's not time for all of them. So, um, I might have to edit this part out. I don't know.
That's all
I'm just
right.
rambling. Um, Thank you so much for sharing your time with us and with me specifically, and with everyone listening. I really appreciate you coming on here and sharing all you know and sharing your time. Is there is there anywhere that you would want people to follow you or anything? Or
I mean, I'm not like an influencer or anything. I'm not like a nurse on the gram, but if you want to follow my book recommendations,
ooh, good
it's pretty
one.
much my whole personal Instagram. It's just like my cat because I just got a cat, and it's pretty much a shrine to my partner. She's my Instagram muse,
Cute.
and my book recommendations, and it's just my full name, first and last name, Sandra Milliken on Instagram. So
You have some good book recommendations though. I have you on Goodreads, and I feel like every time you post something as like a 5-star, either I've read it and I think it's also that, or it's on my list. And I'm like, okay, that's the one I'm reading
Nice.
next. So I just gotta say, I gotta put that out there publicly.
Goodreads
I
is
really
my
like your
favorite
recommendations.
social media. Yeah, it's my favorite. I'm also Sandra Milliken on Goodreads. You can
You should follow her on Goodreads because I'd say it's totally worth it.
Oh man, I'm such a nerd. I honestly feel the best when I scroll through Goodreads and I've just like finished a book and like rated it highly, and then I
Yeah.
see a couple friends like add it to their like want to read list. I'm just
Yeah.
like, am I an internet influencer? Like, should I start getting monetized for this content? Like, I don't know.
You should. That is a good feeling. Yeah, I really like
Yeah.
that. I always get
Yeah.
nervous when people like I have a hard time recommending books to people because I don't know. Same thing with music.
It's
I get
so
a little bit stuck in my
personal.
head
Yeah,
about it.
for
Yeah, it's very
sure.
personal. So it's
Yeah.
always a
I
good
like all
feeling
your
when
books
someone
too.
Oh, thank you.
Whenever you're reading a book, I'm like, oh, that's a banger. She's gonna like love that.
Yeah. Yeah, you're the one that got me to do a couple of the books that I've either finished reading you just finished um Remarkable I just forgot what it's
Remarkably
called.
Bright Creatures.
Yes.
Yeah.
That was a
What's
cute one.
the
I like that
oh
one.
man, delightful little
Yeah.
octopus.
Delightful is a
Yeah.
very good way of putting that. I liked that book a lot.
Yeah. Yeah. I really enjoyed it. The first half was a little bit slower and then it just
Yeah.
like really got going. And I was like, only notes is needs more octopus. That's all I gotta say about
Agreed. Yeah, I agreed. That was so
it.
cute. I really liked it.
Yeah. So
Uh,
great.
Thank you so much. I'm going to end the
Awesome.
meeting, or not the meeting, I'm gonna end the recording. I always forget to say this
Heck
before I
yeah.
do the hit
Yeah,
record, but
no problem.
thank you so much for being here, and I will talk to you
Yeah.
soon.
Nice. Yeah. Take care.
I loved that talk. I loved that talk. I am stoked to be talking about some of this stuff on my podcast because for a lot of my life, this stuff felt like kind of taboo. I kind of alluded to having to deal with having the HPV vaccine and having gotten HPV under not good circumstances. And there's so many years of my life where it felt like I felt so much shame around it. And even with the menstrual health one, like I didn't know that periods like don't have to be painful, and never even thought to advocate for myself until later on in life. So I mean that's a little bit more of a complicated thing as we discussed in the episode, but I'm just really excited that we're to be having this stuff on the podcast. So I really hope that you enjoy it just as much as me, maybe even more. Um, if you have any feedback, any questions for future episodes for Sandra, we can chat about it in our next episode. You can send them to info@movewithbilly.com. That's BILLIE, no Y in there. You can also follow me on Instagram, Facebook, and TikTok @MoveWithBilly. Same spelling, BILLIE. If you're going to do anything, though, following me anywhere, I would sign up for my newsletter because that is the most reliable place to chat with me and get in contact with me. Plus, you get a lot of freebies. Before we head off, I want to take a second and let you know I'm an ambassador now for Offering Trees, the website that hosts my website. Is that how you say it? The place that my website's through. And I love it because it has a little bit of everything. Like you can do your newsletter through there. You can put your on-demand stuff up there. You can do scheduling through there, and personally love it. I'm not being paid to say this. Like I'm not sponsored by them. However, I do get a little bit of money if you use my link, and you get money off. You get a discount. I get a little bit of money. It's a win-win. So you can check out the link in the show notes or in my link tree. I think it's Billy Smith is the link tree. I mean, it's linked below. I don't know why I'm telling you this, but the other thing is if you want to support me in the work that I do for this podcast, because I don't know if you know, but I actually I don't get paid for this part of my work. All of this is free. I'm not sponsored or anything like that. I don't make money. But if you want to support me, you can buy me a coffee, link in the show notes. I think you can do just like $2, $5, that kind of thing. Super, super appreciated. Really means a lot to me. I also want to take a second and thank Elise, who is my wonderful person doing the transcript. Now I'm so stoked about this, and I just really appreciate Elise. So thank you so much for existing and being a part of my business, and I will catch you next week. Thanks. Bye.